Alright, we'll call the public safety meeting to order, and I'd ask for approval of the previous meeting's minutes. Supervisor Frazier, seconded by Supervisor Taylor. Any discussion? Hearing none, all those in favor?
Aye.
Opposed? Alright, and we will start today with Brian, so I will turn it over to you.
Thank you, Supervisor Wood. Item number one is a request to extend our contract that we have with the City of Glens Falls Fire Department for doing our cause and origin investigation services. This is in our budget each year, and this is a one-year extension.
Okay, motion by Supervisor Gerard, seconded by Supervisor Brock. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
Number two is a request to approve our hazardous weather annex, which is a document we put together, and it's part of our Storm Ready community application. We're working to make sure that Warren County is listed as a Storm Ready county. That involves a number of things, one of which is to do the, you should have all gotten this by email, I hope. We're working pretty hard at that. We have added some National Weather Service monitoring equipment, both at Amy Klute's office, our office, and the communication center. And they're working with the hospital, the schools, all these organizations to make sure they have these alert radios. So we're getting real close to that, so that's a good program.
All right, do we have a motion? Supervisor Simpson, seconded by Supervisor Taylor. Any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
Number three is our request to fill the second deputy EMS coordinator position due to resignation. Tom Wardway, who was our second deputy, resigned as of December 31st. He has a number of things going on in his life and some job changes, and he just didn't have time, and I give him credit for the fact that he came to us and said, look, I don't want to not do a good job, so I think I should step down. So we would like to fill that position.
Do we have a motion? Supervisor Frazier, second. Supervisor Gerard. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
Next one is a travel request for myself and Deputy Director Drexel to attend the NYSEMA, New York State Emergency Management Association Conference in Syracuse. And one important reason why we need to attend this one is they are now requiring, all of us took a great deal of training in Albany to be part of the governor's preparedness plan, and all emergency managers took a week-long course. Chairman Garrity took the one-day course. They're requiring us to refresh that every year. So fortunately at this conference we will be able to get our refresher there rather than making it a separate event. So that's good that we're being able to do that there. They're also offering a refresher, just as an aside, to the to county executives that did take it. They can get refreshed at the NYSAC conference coming up.
Motion by Supervisor Taylor, seconded by Supervisor Frazier. Supervisor Taylor, did you have a question?
Yeah, I just wondered, is that a freebie, Brian, or?
Yes, sir, it is.
Okay, thanks.
Any other questions? All right, hearing none, I'll call the question. All those in favor?
Aye.
Any opposed? Okay.
Next one is for myself and Deputy Fire Coordinator Scott Combs to go to the County Fire Coordinator Conference at the Fire Academy.
Move that.
Okay, motion by Supervisor Gerard. Have a second. Supervisor Frazier. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
6 and the following here are all budget amendments that are required for us to bring forward money from the 2014 budget into the 2015 budget. The first one is from the LAPC, Local Emergency Planning Committee grant. You want to do them separately, right?
What's the will of the committee? Would you like to do it? Do they need to?
You just explain them all and we'll do them.
All right, why don't you explain them all, and they'd like to do them, I think,
Not a problem.
together?
Number 7 is the FY13 our Homeland Security grant, which we have not fully expended. That's $22,000. The 2015 amendment is for the FY13 Hazmat grant program. There are still $32,000 left in that account. And our FY14 Homeland Security grant, there are still $59,000 in that particular grant.
I move 6 through 9.
All right, thank you, Supervisor Gerard. Do we have a second? Supervisor Simpson. Any discussion on these? Hearing none, all those in favor?
Aye.
Any opposed? Carried.
That's all I have, unless anyone has any questions.
Any questions for Brian? All right, thank you, Brian.
Thank you.
We'll move on now to the sheriff.
It's up to you, Sheriff.
Thanks for getting right through there.
I got 'em warmed up for you.
I'm gonna be a little more sociable and get out there with you guys. Now, I know I sent it out. Does anybody need copies of the, agenda?
Yeah.
Yeah.
Yeah, okay.
You know, it's rather intimidating if you wear a gun and
Well, I had to wear it here. I usually hide it, but,
We paying 2,200 for that one, Big Short, or?
but, you got yours, right?
I have the updated one I printed.
Martin?
Well said.
I'm gonna hide it, guys, sorry. It's not loaded, does that make you feel better?
No, no.
And
Why carry a gun if it's not loaded?
I can load it real quick.
perception.
Yeah. Good morning.
Morning. All right, Sheriff, you can go ahead whenever you're ready.
Okay, first, A on the agenda is, we need to extend the contract with Global Tellink Corporation for inmate telephone services. This is, it's not a cost to us, it's the percentages we make on the phone calls from the inmates.
Motion by Supervisor Gerard, seconded by Supervisor Simpson. Any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
I'm requesting to amend our existing contract with Correctional Medical Care for one additional, part-time nurse, and it's a cost of $35,000 annually. I talked to Martin about this, this is something that, the head nurse over there, who is a local girl who's working for us, trying to save us money and doing the right thing, needs an extra worker, and I agreed with, CMC that she probably does, and, so I'm asking to amend the contract.
Okay, do we have a motion and a second to
I'll
get on the
move
floor? Motion by Supervisor Taylor, do we have a second? Supervisor Frazier, now discussion?
Yes.
Paul, did you look that contract over, is that,
Martin did.
I haven't, no.
okay.
The contract, we are in the second year of a 3-year contract. There are 2 provisions of the contract that would require amendment. There's a schedule that is a staffing matrix, and to amend the contract, we would add that position to the staffing matrix, and then we would add $35,000 to the pricing list, which is another schedule to the contract. But the contract is very specific as to the titles of the personnel that are employed by CMC, the hours that they work, the days that they work, and the total costs involved. So I think this is if amended, I think this is a fairly simple amendment to the contract, but it would definitely require an amendment because it's not allowed for by the contract right now.
Sheriff, did you have?
Yeah, if I might, I'm gonna give you some stuff, why I think that, these folks are not stringing us along. I know they're doing a great job. Well, I know it because we work with them. I'm down there at least twice a week talking to the head nurse. As you all well know, that some of the county's biggest expenses in jails are medical costs for the inmates. There's a lot of, there's a lot in the medical field that they don't coordinate the benefits for the inmates. It's just, they do their job, and if there's something that they can't handle, they send them to the hospital. If you look on this sheet, I just want to show you how good a job these people are doing managing our care. If you look at the first column, correctional medical care, our 2014 contract with 24-hour-a-day nursing coverage is $1,155,000. Now, the only comparison that I could do for you folks was I did the last year of HHHN's contract, which was 2013. Their service contract was for 16-hour nursing coverage. So we're not really comparing apples to apples. We got a better product now than we had before because of the 24-hour coverage. But I wanted to at least have you look at what I'm looking at when I'm making these decisions. That service contract for 2013 was $516,000. Now, $600, and it was going to go up $77,000 for 2014, it was gonna go up 15%. So if you look at all the expenses that are incurred, with that contract, you got Albany Medical Center, Albany Medical College, the psychiatric hospital, if we have to send somebody with mental health problems out west, the mental health doctor, the dental doctor, radiology, Glens Falls Hospital, Kinney Drugs. If you look at Glens Falls Hospital, our charges in 2013 were $181,752 for hospital stays, and our Kinney Drug contract was, for inmates, was $175,000. So those two alone are, $360,000. That's a big bite. Then you got the emergency squads that transport the inmates. You got Stericycle, Baywood. If you add them all up, and then you add up the overtime for 2013, and a lot of the overtime was because we had a lot of medical watches at the hospital, a lot of medical watches. You add them all up, and you come up with $1,704,000 actual cost. Well, take out the $77,000 as your actual cost, but I'm trying to give you what it would be in 14. If everything else stayed the same in 14, the cost would have been $1,704,948, and I submit that those costs wouldn't have stayed the same. The drugs would have probably gone up, the hospital stay would have gone up, but I'm trying to do it as fair as I can. You look at our actual costs for 2014. We've saved almost $200,000 in overtime because we're not going to the hospital. We're doing it, mostly everything in-house. I checked with our contract, and I got the numbers yesterday from CMC. Our actual hospital costs for 2014 were $54,761. So you can see we're not sending a lot of people down to Glens Falls Hospital. We're not sending a lot of fake calls out. The nurses and the doctors that are on hand are taking care of that in-house, and we do not have to incur a cost at Glens Falls Hospital. And our scripts for 2014 were about $30,000 less, $144,000, and that should even been lower, but the reason, there were 3 people that we had in there who had some huge prescription costs, and that made that probably about $40,000 higher than it should have been. So these are all the numbers that I'm looking at. Overall, we're saving a lot more money when you manage the care in the hospital. So when they ask for a part-time nurse, for me, it's a no-brainer. I think we should give it to them. I know it's not fluff. It's something that they need to keep the care managed in that. Yes.
This $1,000,007, that doesn't include a guard having to go down with them, does it? Like when you have to send someone to the hospital.
But that's the overtime, yes. That's where the overtime comes in. The overtime is in there. That's what we paid, and if you look, our overtime was the highest it's ever been. In 2013, it was at $655,000. That was about $300,000 over what the 8-year average was. So those figures are figured in there. How much is actually spent for overtime for just the hospital? I didn't break it down that much, but you can see that there's a huge difference in overtime costs for the 2 years. So that's my reasoning. I wanted you guys to understand it. That's why I thought this $35,000 contract is, to me, is a no-brainer.
Supervisor Gerard.
We just did our budgets, here we're only into the, 21st of January. This is an additional $35,000 that would go into the budget?
No, I believe that we have it in the budget to pay for it. I don't think we have to add to the budget at all.
Okay, because the only problem, but as we prepare budgets, and we're pretty thorough about sitting down and going through the needs, why January 21st would this come up and not come up through the budget process?
Well, it came up after the budget process, and I didn't want to complicate the budget going through. I wanted the contract to continue with CMC. I discussed it with Martin, and I said we could make an amendment if the board feels it appropriate, and I showed you the reasons why I thought it was appropriate, but this did come up after the budget process, that they wanted a part-time nurse.
And how does it, are you gonna have to amend the budget process also?
No,
Or do you think that you can,
No, I think we have it in the budget process. It's already budgeted, and we may have to move it from one code to another, but I think we can do it. I don't think we're gonna have to add to it. We're not gonna have to go to contingency to make this, I don't believe.
Any other questions for the sheriff? All right.
Mike, before we go,
Go ahead.
Mike, did I miss anything? Was there anything else on the?
Hit it right on the head, Sheriff.
and just lastly,
Yep.
how does this, can you explain a little bit of the proficiency of how this goes forward with the new person on board? How it helps, in other words, with all the things that,
Or as far as staffing wise?
yeah, do you have 24 hours coverage now, is that
Yes,
what?
24-hour coverage. Instead of, in the old way, the nurses under Hudson Headwaters would not do nursing assessments. In this new company, the nurses actually do a nursing assessment. They make an initial, excuse me, determination or diagnosis, they confer with the doctor. Because that's where a lot of the savings is. On Hudson Headwaters, they would wait until the doctor came in on Monday, Wednesday, or Friday. So now, nursing assessments are being done 7 days a week. Will allow for enough staffing to make sure those occur 7 days a week. You are catching those problems and treating them before they become a bigger problem and a more expensive problem to treat, especially when it comes to narcotic withdrawals. Those are, if you don't catch them right away and get them treated, you're gonna end up in the hospital.
Does that answer your question, Dan, or not?
I'm not against it, I'm just trying to formulate, in other words, why wouldn't you ask for 2 more nurses or 3 more? In other words, we have a contract with them, we had a budget process, and now we wanna refine and make it, I guess, more efficient and better on both sides of the fence. Better for the healthcare, for the actual inmates, and actually better for us so that they don't end up down the hospital. And I'm understanding that, but why, if we have a contract with professionals, why wouldn't they see that? Why are they calling for it, like, after the fact? And how are we gonna,
Well, they've never managed our facility before. Each
Okay.
correctional facility is unique to itself. When they come in, there's going to be an adjustment period to see how we operate security-wise to them as medical-wise. So now that they've been here for a period of time, they're asking for an additional part-time nurse to make sure those assessments are done in a timely fashion, so we don't incur extra costs.
okay, and from your professional viewpoint, that their assessment is accurate and correct?
Yeah, and Dan, I would add to that. I think where the problem, where it gets to be a real problem in jails across New York State and probably across the county, is that there's a breakdown between the correctional staff and the medical staff. And what I mean by that is they don't work as a team. The medical staff will go in there, you know, you guys stay over there, just make sure we're safe, and there's no talk between them as to, you know, this inmate's a problem, my nurses have to give him his pills, can we have extra people there? We do this on a daily basis. We meet with Kirsten, who's the nurse manager, a local girl, like I've known her since she was born. She's a good person, and correctional medical care hired a good person in doing this, and she is concerned about medical costs as well. And that's why, on a daily basis, she's confirmed with the sergeant, the captains, and the lieutenants to say, hey, we've got a potential problem here. We got somebody that we've got on that's coming down off of heroin. We may have to put him in the hospital if we can't manage the care here. So it's a working relationship, which we've never had before. Before Mike would call me up and say, hey, the nurses are sending 3 inmates to the hospital because they've complained of chest pains. And they can't do an analysis to see if that's really a chest pain. So for them not to be liable, they just say, ship them to the hospital. Let them.
And what happens now with that?
We have to send 2 people down with them to the hospital, and we have to sit there until they go through the whole process, whether they need to be there. Then they're examined by a doctor to see what the problem is. That never happened before. It's happening on a day-to-day basis now, where we just don't send anybody to the hospital. If you notice the cost, $181,000 to the hospital as opposed to $54,000. That's a huge difference, and that's because we're managing it.
Supervisor
Currently,
Brock?
our medical is now equipped with an EKG in-house. Before if they complain of chest pains, nurses are doing an EKG on site, they're trained to do that, they're certified to do that. Those results are relayed to a doctor. They do a couple other testing, and an analysis is made, the decision is made by the doctor whether that individual has to go or not.
And that's something that correctional
Sorry.
medical care brings in. They bring in their own x-ray
And
equipment.
that's new, this
With this
service
service provider.
Yes,
Yeah, 'cause I'm aware, I was aware of a lot of runs that you were getting because of that.
right.
Last time I figured it, I believe it was last November, in 2013, I believe it was, we had 111 days in the hospital. In 2014, in November, for that same period of time, we had 30.
All right,
Supervisor Brock, did you have
Yeah,
something?
I don't mean to speak for Dan, but, the CMC has a year under the belt, and so now they're looking at it. They reviewed that last year, and now they're coming to us. But in the future, they won't be new to the system anymore, so the chances of them not having the assessment done before the budget process begins is probably
Yeah,
not gonna happen.
that's not gonna happen again, no,
Right, so
absolutely.
this is an because what Dan's really saying is this should be part of the budget process.
Absolutely should, and that was not all their fault. I can take some of the blame. I knew something shortly after the budget process, but I didn't wanna complicate the issue because of some of the problems in the news that CMC was having, and then with the Attorney General's office, we've got them straightened out. I wanted to make sure that and if you remember, I sent you all an analysis of what CMC did, and that was a very accurate analysis. They're really doing a good job in trying to do what the state wants them to do. So I didn't wanna complicate it by saying, oh geez, now you're asking for another $35,000. I wanted to get through the process, and I wanted to get this analysis out so you could understand what I understand in making this decision.
The only thing when someone comes after the budget process, it's my thinking is either they didn't think it through thoroughly before the budget process, or they're trying to slip one past us, which I'm not accusing you, so you don't wanna make it a regular habit of,
Oh, no.
So that's,
Well, they're not slipping it past me, and
No,
I'm certainly
or-
not, and I'm not certainly trying to slip
No,
it
I'm not
past
trying
you.
to- I'm just saying-
That's not how I work.
no, I'm not, I don't mean to imply that, but I'm just saying that's, if that
understand that.
happens, that you start going, there's a red flag. And
Yeah, no, I certainly understand that.
Or does the committee have any other questions for the sheriff?
I have a question, but I guess we're struggling with this, I think, because we tend to look at that bottom number and think that's a fixed number, and it's not. If Martin says the contract is good, and you're telling me you've done an analysis, and this is gonna be cheaper, who am I to question the people that know what they're doing? But
Well, this first year was a big, big win-win, but you gotta understand, though, the hospital stays, even though they were $54,000, there's nothing to say that next year, that it's up over 150.
Yeah.
It depends on who you get in as an inmate. I mean, we've gotten inmates in the past, Bud, that had terminal cancer. Why they're in jail, I don't know, but they end up in jail. A lot of times, jails are a medical stop for somebody in MHU with mental problems or with physical problems that the courts don't wanna deal with, ship them to jail, but it becomes an expense for all of us. So, could they be higher next year? They could be, depending on, if we get a terminal, cancer patient, which we've had before, we've had to spend $25,000 in 1 week for cancer treatments. We had to pay for that for 1 week, and they were only in jail for 2 weeks. But we incurred that. So you never know, it is a huge moving target, but this group tries to manage that. And so far, they've proven that they're doing a good job, and we're keeping an eye on them. They know we're right there every day watching them, and if there's a problem, we call them. I call the president of the company sometimes 2-3 times a month if there's little issues. And we have a great relationship. Understand it. He doesn't wanna lose our business, but he doesn't want his people getting sued for not providing the care. So he's gonna provide the care the way he's supposed to, and he's gonna make sure that he's doing due diligence for the county, that we don't incur more expenses, because he knows if we do, and we feel that he's not doing a good job, you're out of here. Because I do that all the time. If I don't think I'm getting a good vendor in, I get rid of him, I get another one, trying to save money. So far, you guys are great. That's all I can tell you.
I have one final question.
Sure.
What's the budget number for this package? What did you budget for this?
For next year, it went up, I think we budgeted 1.55, there was like I think there was a $40,000 increase, so it might be 1.2 something this year, I don't have the numbers, but it's 1.2 million, I think.
That's right. Straight out of the contract, the sheriff is right. It's 1,207 for this year, 1,207,000 and change. And, year 3 is 1,262,000 and change. So the sheriff is right. There's about a $50,000 increase annually that when we approved this contract 2 years ago, we knew that there were gonna be those annual adjustments.
Okay, any more pressing discussion? If not, why don't we call the question, all those in favor?
Aye.
Any opposed? Okay, moving on to C.
I'm glad we did that first rather than last.
Is that the hardest one, I
Yeah,
hope?
no, well, I hope so. And just to reiterate, I know I've said it 100 times. Any of you have any questions about anything we do over there, anytime, I'm not trying to slide under anything to anybody. Come over, talk to us, I guarantee you that I might not always know the answer, but I can guarantee you I'll find out the answer, because we have people that can get the answers, so we'll get them for you. All right, next one is C. We gotta amend the existing contract with Train for heating and cooling maintenance. The cost is 6312, and it's a $243 increase from 2015.
Okay, motion by Supervisor Gerard, do we have a second? Supervisor Frazier, any discussion? Hearing none, all those in favor?
Aye.
Opposed? All right, we'll move on to D.
We need a reso to send, Patrol Officers Jeremy Kuhn, Peyton Ogden to the National Drug Interdiction Conference in Virginia. Cost is $650 for the training, plus the $520 for the room that week. And Sean, if I'm correct, this is something we take out of, asset forfeiture.
That's correct, sir.
Okay, do we have a motion? Supervisor Simpson, second. Supervisor Taylor, any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
Request a resolution to move $2,154 from fiscal year 214 to 215 in the A31104010 code. This money amounts to, donations that we get specifically for our K-9, and we don't always spend all the money for the K-9. Move it, we lose it. So that's specifically, those people that give that money want it for the K-9, so we have to keep it there.
Do we have a motion? Supervisor Taylor, do we have a second? Supervisor Brock, any discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay.
Request a resolution to move the remaining $21,283 from the 2013 to 2014 PSAP grant to fiscal year 215. Account code is 30204025. These monies will be used to assist in improvements to the 911 center communications security system. And Sean, if you could explain that a little further, we didn't spend all those monies to begin with?
That's money that was left over from a grant. We had been granted $425,000, and that was to go into our refresh of our 911 system, both in the main communications center and in the backup communications center. We're able to do some things better financially, and that is the money that we have left over. I've been in touch with the Homeland Security, and I questioned whether we could put that towards another project that we wanted to do, and they said that that was feasible. That's what we plan on doing.
Okay, motion by Supervisor Gerard, we have a second. Supervisor Frazier, any discussion? Hearing none, all those in favor?
Aye.
Opposed? Carried.
Procedurally, Joan, I hope I did the last one all right. I put a bunch in there. Is that procedurally okay, or would you prefer it broken out?
Just the codes are broken.
Yeah, well, I've got the backup for it is broken out, I believe, and the codes are broken out. Request resolutions to amend the county budget as follows. Revenues to be received from the terrorism prevention grant in the amount of $20,000 for the purchase of scene lighting and night vision equipment. Revenues to be received for child passenger safety grant, the amount of $1,300 for child seats and supplies. Revenues to be received in the amount of $31,250 from traffic safety grant for overtime and supplies. Revenues to be received from the PSAP operations grant in the amount of $175,166 for 911 upgrades. And if you look on the back, that's what we're buying. These are the equipment that we have to use it for.
All right, do we have a motion? Supervisor Frazier, second by Supervisor Taylor. Any discussion?
If you have any questions on any of the grants, please, that's why Sean is here, we can answer any of those.
All right, hearing none. All those in favor? Any opposed? Carried. Anything under topics for discussion today?
Yeah, just to let you know, we filled the three positions in corrections, one resignation, and I think they've gone on to work for the state, that one resignation, is that correct?
Correct.
They wanna, and two to fill the staffing analysis, it's budget neutral. So, I think we're right up to snuff, Mike, or
We're currently filling these, we're in the process of doing one sergeant, existing sergeant, and one additional new sergeant under that.
and we'll be up to staff as to, what the staffing analysis is until July 1 hits, and we'll be facing those, okay? Any questions?
No, no question, I don't think.
How about if we, Rachel Sieber is the one that asked this question. I mean, we can table this law library until next time when she's here if you wanna do that, or we
That
can
seems
discuss
fine with
it
me.
if you
How
want.
does the
It's up to
committee
you.
feel? Is that fine?
Yeah,
Okay.
Go ahead, Dan.
I didn't know if you had a cheaper alternative, is that?
Well, let's discuss it briefly. What I did was I checked with Martin, who uses, Westlaw, I believe, right, Martin?
Yep,
Or
Martin
Levin.
uses it, but-
Martin's, the attorneys at Social Services uses some Westlaw stuff. Who else? DSS uses Westlaw. Martin, our office uses LexisNexis. So the people that use it, there's like, the district attorney, there's really not much of a difference in prices whether you use Westlaw and LexisNexis. So, and they each have different needs, so those contracts would have to be, negotiated between like the county attorney's office, the district attorney's office with Westlaw or LexisNexis. So I asked about pushing them all under one. You're not really saving any money, you can't tell, they're pretty much the same. Where the money comes in is the law library for the corrections. That's where we're paying $40,000. We actually have a guy coming today, that has another, is a competitor. I don't have those numbers yet.
Okay.
I don't know if we're gonna
That's
save
great.
any money, I think it's gonna be probably close. That number was like $40,000. So we'll at least find out.
But you must talk to other counties and whatnot and have a pretty good framework of that this is what you have to do, or
Yes,
is
yeah,
there
oh,
anybody-
yeah, you do have to do it. We've looked at,
But I mean, there's nobody else doing it cheaper.
no. And you gotta do it smart too, right, Mike? I mean, tell us some of the stuff that we could do.
The law library system, the inherent cost of a law library system is equipment and personnel. Jails, we have a kiosk in each unit, so we have no staff costs involved in our unit. The inmate needs to look up law library systems. He goes over to the wall, he does his own legal research. Facilities that have a main law library system, that's a manned post. So now you're paying salary and benefits so that an inmate can access their legal work, which we don't incur in our facility.
And
That's one of the things you have to look at. You have to look at the equipment costs. Okay, now what are your personnel costs to go with it? Because ours are nominal.
So, and once this guy leaves today, I'll bring back another report, and, we got some other things that I think that the county will be interested, something that Mike had reminded me of, that I had forgotten, that you'll be pleasantly surprised. So let's discuss it at next month's, meeting.
That's fine with me.
That's okay with
Go with
everybody?
the kitty? All right. Anything else for the sheriff this morning? In that case, we'll have a motion to adjourn. Motion by Supervisor Brock, second by Supervisor Frazier. All those in favor?